Good afternoon, everybody. First and foremost, I hope that you and your families have been safe during this unbelievable crisis. Second of all, I want to thank you for your dedication, not just to the department, but to all of the citizens in the state of Georgia. We've talked for years about how we touch everybody in Georgia's healthcare experience, and thank you for what you've done during this crisis. I wanted to share with you a couple of updates from the department of what we have accomplished during the last 7 weeks as we have been working remotely. First and foremost, we helped the state of Georgia stand up the Georgia World Congress Center. In a period of 72 hours, a contract was implemented that allowed for 200 beds to be set up in Arena A at the Georgia World Congress Center. While we have not used many of those beds, knowing that that was there as a safety net played a critical role in our process as we have addressed the concerns during this crisis. Second of all, we helped establish staff augmentation in both hospitals and nursing homes. That was critical to ensure that the patients in the hospitals and the residents in the nursing homes could continue to get high quality care. We partnered with Jackson Healthcare to ensure that we had high quality team members through a contract, included nurses and doctors and technicians that could go into those hospitals that were in need and nursing homes who were challenged with both serving their patients and with staff who themselves had come down with the virus. I want to thank Jackson Healthcare for their commitment to both the department and to the citizens of the state of Georgia. We also implemented and successfully implemented waivers to the Center for Medicaid and Medicare Services to address unique ways of serving the population that were hit by this virus or were at risk of becoming sick if they had to get into the hospital or a primary care physician. Telemedicine was one of the greatest examples that we were able to successfully accomplish through the waiver process. I want to thank our Medicaid team for all of the work that they did for the successful submission of those waivers. I know many of you have been wondering, when are we going to return to work? We will return to the office when it's a safe and healthy environment to return to. Right now, we are working closely with the governor's office to determine when that date will be set. However, in the meantime, we will continue to manage this crisis remotely. I no longer refer to it as teleworking. I believe that our team has been dedicated to managing this crisis no matter where you are. For me, that has been at the Georgia National Guard, it's been at the Georgia Emergency Management Agency, and it's been here at 2 Peachtree some of the time. Each place that I've worked, I have had the opportunity to develop new friendships and partnerships with people who are equally dedicated to our mission, helping serve Georgians in a time of crisis with unbelievable access to high quality health care. I want to again thank you for your dedication to our team. Please be on the lookout for messages from your supervisors and managers of when we will be returning. But in the meantime, I take great pride in knowing that our commitment to our cause stays firm no matter where we're located. Thank you so much for all that you've done. Have a good afternoon.